ACL injury causes and treatment. An ACL knee injury is actually a torn anterior cruciate ligament. This is medically termed an ACL sprain. It is one of the most common knee injuries, especially among contact sport athletes and athletes participating in high-demand sports. A sprain is the stretching or tearing of a ligament. Sprains are graded by the degree of injury to the ligament as follows. Grade 1. Mild stretching or microscopic tearing of the ACL ligament that doesn't leave the knee joint unstable. Grade 2. A partial tear in the ACL ligament that results in the knee joint becoming loose. Grade 3. A complete tear of the ligament that results in knee joint instability. This grade is most common in ACL injuries. ACL injury symptoms include an audible pop as the injury occurs. Mild to severe pain and swelling will usually appear within 24 hours of the injury. Local tenderness and range of motion limitations. A wobbly feeling about the knee or the knee buckling or giving out during movement. Discomfort during walking, running, jumping and such, and the pain may occur from just putting weight on the affected leg if the injury is a grade 2 or 3. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your knee to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the knee. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your knee with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold or damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your knee with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your knee to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your knee with the sinew warming soak to bring warmth into the knee to drive out coldness of damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The sinew warming soak is particularly useful if your knee is more painful and sensitive to cold, or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your knee. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.